Have you ever considered becoming a drugstore cowboy? Because then you would only wear your boots on Friday night, right?
Right.
So then you wouldn't get so stiff in the ankles. He is very tight in his hip rotators. And there are a large number of hip rotators. Lots of writings just focus on the piriformis for the simple fact that the sciatic nerve might pierce it. When I treat hip rotators, I treat all of them. Now, he lays with his feet pointed outward, you know, probably 25 degrees outward on this side, maybe slightly less on the right, okay? That tends to encourage weight bearing on the outside of the foot. That's called supination, okay? And if we could restore some internal rotation, then you would naturally walk with more balanced weight bearing in your foot. I'm quite sure you're still, even though we restored ankle motion, you know, I think you're still weight bearing a lot laterally. Okay? Now the way I like to test hip rotation is I roll the leg in with them laying on their back, and I can take you only about 10 degrees, and then it's extremely tight. Okay? Now there are other ways of testing it. Some people test it with you sitting in a chair or laying on your stomach with your knees bent 90 degrees or with you on your back. But that's a completely different context. I would never avoid testing you in supine because I'll find restrictions there that are not found the other way. When we bend your knee, the hip behaves very differently, and you have 30 degrees and it has a soft end feel. So people would say, that's normal? I'm like, wait a minute, test it down here because this is not normal, okay? Sadly, there's no research on my technique, so boo-hoo, I guess we can just cry about that. You know, I'm not a researcher, but I do share the information. I think someday someone will research that for those who need a published study in order to pat themselves on the back and use the material, and it's a sad commentary, but it is what it is. Okay, I also treat it very simple, and I treat it once only. Another boo-hoo. It's a bad business model. And I teach patients to roll up a towel 2 inches diameter firmly, a hand towel, or this is 2x4 by 8 inch foam. You can find it online. We also sell it. And I place it under the trochanter. So his trochanter is this bump right at his pocket. And if you roll the leg in and out, you feel that bump pop out. That's the trochanter, okay? The foam is in line with the outside of his pelvis. And if he puts his hands out straight and he bends his pinky at the knuckle, then that's at the bottom of the foam. So now you know how to treat yourself, okay? And your homework is going to be to do this twice a week, okay? So you're going to lay on the floor or on the massage table, and you're going to put that foam underneath you, and you're going to do it for 3 minutes. So I'm going to set a timer for 3 minutes, and I'll be back, and we'll film the response of your body to this treatment. Okay?